with Dr. Benita Zahn.
More than 6 million Americans are living with Alzheimer's disease, a number that's expected to climb to 13 million over the next 30 years as our population ages. And death from Alzheimer's and other dementias climbed 16% in this country during the pandemic. But the experience of white and black Americans diagnosed with Alzheimer's disease is different, and that affects care and treatment. Dr. Julia Hastings is an associate professor at Albany in the Schools of Public Health and Social Welfare, and she recently had a grant funded looking at the burdens experienced by teens in the home of a loved one with Alzheimer's, as well as their caregiving parents. Good to have you with us, Dr. Hastings.
And very nice to be with you.
And also with us is Beth Smith Boivin. She's the executive director of the Alzheimers Association, Northeastern New York chapter. Good to have you as well.
Thank you.
This is clearly a disease of all races, and I'm going to start with you, Beth. It hits the African American, the black community in a different way, particularly vis-a-vis when diagnosis happens and the problems that brings. So let's just talk a little bit about that to start.
Mm-hmm. No, you're absolutely right. The Black community is twice as likely as the white community to develop Alzheimer's disease or other dementias, and yet their rate of diagnosis does not keep up with what we see in the white community. And that, of course, is very troubling and has implications for both family caregivers as well as professional caregiving, and very significant implications in research.
And now we've got the numbers out there. So Dr. Hastings, let's take it from there. So the diagnoses happen more frequently, but they happen later on in the disease process. And you're looking at the impact on family caregiving. What are you finding?
I'm finding that families these days are keeping their loved ones at home much longer, and they're really trying to make it work with their family budget. But also that it's not only just the adult caregivers, but it's also the adolescents that are taking care of their loved ones. And we need to pay some attention to the entire family who's going through this experience.
And why hasn't the family at all been examined in terms of the support they need, the education they need? Have you found anything yet in your research to date, Dr. Hastings?
Well, to date, I have found that adolescents are struggling with trying to take care of their grandparent or their older adult loved one just as much as the adults are. Some are even working to help sustain the family financially. And I would say the stress that all family members feel is felt equally, and it's not kind of overburdened on just the parents. It really is for all family members.
Beth, are you seeing this in white and non-black families as well?
We are indeed. And it's interesting, Benita, because back in the very late 1990s, I began to look at this particular issue of the impact of Alzheimer's disease on children and teens. And indeed, we found that they were impacted greatly. So many of these children are grandchildren, as Dr. Hastings pointed out, and they find themselves in a very unique position of having to assist families, sometimes with very intimate activities of daily living. I worked with a young man at one point in time who was giving his grandfather a bath, and terribly uncomfortable doing that. And yet this young man's mother thought it would be more comfortable for both the gentleman with the disease as well as the boy because of the same-sex situation. In fact, the difference in generation made that very uncomfortable. Another thing I learned since the late 1990s is that many, many young children are now becoming caregivers for their parents, because we're seeing an increase in early onset Alzheimer's disease, and we're seeing people that have children later. Yeah. So as a consequence, these kids that we used to see providing caregiving support to grandparents to a large extent are now providing it to parents as well.
Jill, Dr. Hastings, first off, we saw the numbers increase in terms of death from dementias during the pandemic. And you also now have teens who have been away from their friends and other supports during the pandemic. Is there any information yet from your research indicating how that has become an additional burden, a strain on these teens who are also providing care for their loved ones? And then the corollary to that is, how do we help?
Preliminary data do suggest that teens are suffering because they are not being able to be in contact with their friends. Technology is a wonderful aspect for those teens that actually have it. There's a lot of texting, there's a lot of FaceTiming, there's a lot of other technology going on. However, it is still not the same as the pro-social behaviors we hope teens would be doing with being with their friends and their activities. And so they are suffering not only just their stress in the family, but they're suffering in their schoolwork, their own emotional development, as well as in their understanding of who they are and at the stage of development they are.
And the underpinnings of racial disparities in healthcare, where does that come into play in all of this?
Well, it comes into planning. I mean, I've seen early information from my study shows that even the adult parents are not planning for their own health care, as I would say Beth has suggested, and their own early diagnosis of Alzheimer's disease. And you have the situation where you have teens who see this going on in their family, and they too need information. And so we just need to start focusing on trying to inform and help the entire family
and
to gain information about the course of this disease.
Yeah, I'm sitting here, I'm the timekeeper as well, as you know. And Beth, what in specific or in combination with Dr. Hastings' work is the Alzheimer's Association doing to address this?
So many things, because to your point, not only is there disparity here in the rates at which we see diseases like Alzheimer's and dementia, but there's also healthcare disparity in terms of access to service, as Dr. Hastings described. And so we need to move the needle on this significantly. In the fall of 2020, just this past fall, the Alzheimer's Association launched a special project with NIH looking at how we can improve both of these issues, both earlier diagnosis, better access to quality care, and then higher rates of enrollment in clinical trials.
Yeah,
because without that, we won't know how the treatments impact various populations.
Yeah, I said I'm looking at a number that says only about 5% that African Americans only make up about 5% of participants in these clinical trials. So clearly a lot of work to be done. Clearly there's conversation going on and outreach that's going on. And Dr. Hastings, I know that I'm sure Beth and the organization will be looking to more of your findings as they go forward to try to level the playing field and help those who so need it. Dr. Julia Hastings at Albany, Beth Boivin at the Alzheimer's Association. Ladies, thank you. Very important work being done. Information has to get out there. And just if you have questions, we've got a link up at our website here under links for the Alzheimer's Association. So check it out. Nobody should walk this walk alone. Thank you for joining us for this edition of Health Beat. It's your health info on the go. Be well till next time.